Greetings of peace. Assalamualaikum warahmatullahi ta'ala wabarakatuhu and good day everyone. Today we will be discussing the Unit 5 Psychotherapy or your psychiatric therapies, which focuses on different treatments used to help patients with mental health conditions. Okay, psychiatric therapies or psychotherapies aim not only to reduce symptoms but also to improve a patient's overall functioning and quality of life. Now, previously we have discussed psychopharmacology, the medications. Now, let's discuss what are those therapy that also increases or improves the well-being of the patient. Again, this is the same with your psychopharmacology. This improves or this manage symptoms of the patient, and this doesn't cure the problem or illness of your patient. Okay, so again, psychiatric therapies or psychotherapy are designed to improve mental health and functioning, address maybe physical, psychological, social, and biological factors, and this be used or often used in combination for better outcomes. So, example, in combination with your medication such as anxiolytics, you will give another therapy to your patient. Okay? So, again, this is not used to treat psychiatric illnesses but to have a good or better outcomes of improvement of the patient. Okay? It is focused on symptom reduction and improved coping. So again, it is important to understand that no single therapy works for all patients. So treatment is usually individualized. Not patients experiencing schizophrenia, depression, bipolar can be treated with one single therapy. They can be exposed to different therapies, what suits to the patient and what is effective to the patient. Okay? So, the main goal of this therapy is to help patients develop a better coping mechanisms and emotional stability. So, it is all about the symptom reduction to help them able to cope up with the stress and to manage the symptoms of their diseases. Okay? So, psychotherapy is a treatment approach that involves structured interaction between a patient and a therapist. And through this process, the patients are able to explore their thoughts, emotions, and behaviors, to understand their behaviors and builds insights and coping strategies, and to develop healthier coping strategies. So this is often referred to as talk therapy. So from the word talk therapy, communication process is very important in therapy. So without communication, without therapeutic communication, you cannot properly apply psychotherapy. So common examples of your psychotherapy includes cognitive behavioral therapy or your CBT and psychodynamic therapy. Okay, so now let's start with the different types of your psychotherapy. The first one is your cognitive behavioral therapy or your CBT. So CBT, okay, focuses on relationship between thoughts, feelings, and behaviors. The idea is that negative thoughts lead to negative emotions and behaviors. That's why the CBT helps patients identify their negative or distorted thinking patterns. They teaches or they challenge negative beliefs and replace them with healthier thoughts. They either teach skills to modify unhealthy thoughts and behaviors, and this type of therapy is very effective for depression, anxiety, and many other disorders. So example, a patient who thinks I am worthless learns to reframe it into I have strengths and it can be improved. Okay? So again, CBT helps patients identify distorted thinking, challenge negative beliefs, and make them or replace them with a healthier thoughts. So those negative beliefs, those distorted thinking will now be replaced with more healthier thoughts. Okay, so again, they focuses on connection between thoughts, feelings, and behavior. behavior. So this type of therapy is very effective for depression, anxiety, and many other disorders, usually stress related. So another therapy is your behavior therapy. This focuses on modifying. So this focus on changing, modifying maladaptive behaviors or unhealthy behaviors. It uses the learning principles such as your reinforcement and conditioning. Okay, so what we call techniques may include also, okay, common techniques in behavior therapy may include systematic desensitization and your exposure therapy. When we say systematic desensitization, it is the gradual exposure of a client to a feared object or situation. So you expose, example, fear of spider. So your patient, if you are going to use systematic desensitization, you will expose patient to certain objects that first is objects such as spider, and then the later part will be the actual example or actual spider itself. Okay, so this is the systematic desensitization. Now, for your exposure therapy, it is a direct exposure to reduce fear over time. So example, a patient with a fear of heights is gradually exposed to higher places in a controlled manner. So this type of therapy, which is your behavioral therapy, is commonly used for patient who has phobias or if you can still remember your phobias, these are your fear of unknown, okay, anxiety disorders, or fear of a specific object or anything, anxiety disorders, and OCD or your obsessive compulsive disorder. So again behavior therapy focuses on modifying maladaptive behaviors. If for cognitive behavioral therapy, it focuses on identifying the relationship or your thoughts, feelings, and behaviors, and the idea is to lead the negative thoughts, okay, that they get any negative thoughts to more a positive thoughts and healthier coping strategies. While your behavior here we change or we help the patient change their maladaptive or unhealthy behaviors. Okay. So next we have your dialectical behavior therapy or your DBT. Now, for your dialectical behavior therapy or DBT, this is specifically developed for patients or individuals with borderline personality disorder. But it is also used for other conditions. It combines the CBT or your cognitive behavioral techniques and your with mindfulness practices. So your DBT teaches patients to regulate their emotions, okay, distress tolerance, okay, and encourages interpersonal effectiveness. So for example, instead of reacting impulsively, the patients learn to pause and respond calmly. So example, you have done things that is not good, and then the patient will now shout and react something like that. So by avoiding that, or to avoid that kind of problem or stress to a patient, you teach them how to first relax and to respond to any stress calmly, so that it will not further cause any problems to your patient. So again, DBT is specifically developed for patients with borderline personality disorder. However, it can be used for other conditions. It combines your CBT or your cognitive behavioral technique, or making the negative thoughts into a positive one, okay, with mindfulness technique. Okay, so it teaches the patient to regulate their emotions, to tolerate distress, and to make interpersonal effective. Okay, now let's talk about group therapy. So another psychotherapy that involves multiple patients working together with a therapy. So here, this may include at least 4 to 7 or maximum of 10 patients having or working together to improve their well-being. Okay, so benefits of this type of therapy. First, it encourages sharing experiences, okay, and mutual support. It improves also communication skills and social skills. So this is very common, commonly used in inpatient and outpatient settings. So here, in this type of therapy, the patient realizes that they are not alone in their struggles, that other people may experience the same struggles, and with the sharing their experiences, they may come up with an idea to do things just like other, okay, or to make a solution for their problem with the same problem of others. Okay, so this is very common or commonly seen with what they call this, any movies that what they call this, that a character has a psychiatric illnesses. They do this one every now and then, no? It's very very important that you really have to identify this type of therapy. This is very effective also for those people na needs to improve their communication skills. However, those introvert people or introvert individual, they not really fun of having this type of therapy. You either expose them or systematically desensitize them for exposure to others in a gradual manner, and then if they're not okay, or if they can tolerate it, then they can go to experience group therapy. Okay, so another therapy is your family therapy. So this includes family members in the treatment process. So the goal of this therapy is to improve family communication. They address dysfunctional patterns or any conflicts within the family, and they are useful for children, adolescents, and patients or individual with chronic mental illnesses. So they also address unhealthy family dynamics. So example, helping parents understand and support a child with depression. So it's very important in treatment process, it's very important that there's a presence of your support system or family in the treatment process, because without them, it's really hard to improve the well-being of a person, because remember, no man is an island. Okay, no man can survive without any connection from another or from other person, okay, such as your family, your friends, your relatives, or any significant others. So it's very, very important to get that kind of support from your family, or good support from your any relatives or any significant others. Okay, so family therapy includes family members in the treatment process. So another is your milieu therapy. So milieu therapy refers to the therapeutic use of the patient's environment. So here, in this type of therapy, we change, okay? We change and structure the setting or environment of the patient. So in this approach, the environment is structured and supportive. Okay, the patients participate in daily activities, and social or interaction is encouraged. So this is very common in psychiatric inpatient units. So for example, in a psychiatric ward, patients follow schedules, attend group activities, and interact with others. So this helps, or this type of therapy helps social skills, responsibility, and self-control. So example, if I can way back with my experience in Cebu, Cebu in they call this Vicente Soto. We usually, or some nurses usually do this therapy. They follow specific schedule, okay, and they they allow the patients to attend group activities such as dance therapy, okay, music therapy, art therapy, making those kind of therapies to improve their social skills, and they allow those people, okay, to interact with each other, okay. So they give they call this they give sense of responsibility to those patients, and I can see it uh when I was there. I really experienced it, and I was amazed on how these people are trying to get better. Okay, some are not that okay, but some, okay, is really trying to recover. Okay, now another therapy is your somatic therapies. So again, this is from the word therapies. This is a different treatments or therapies. So somatic therapies are biological treatments affecting the brain function. So examples or therapies that is included here is your electroconvulsive therapy or ECT, your transcranial magnetic stimulation or TMS, and your light therapy. Okay, so let's identify these three therapies. Your ECT or electroconvulsive therapy is used for severe depression, and it is effective when medications fail. Okay, so there is a direct, what they call this, control of the brain. Okay, so the patient's brain is attached to what they call this, wires, okay, that sends radio waves, okay, to, they call this, to give electrical signals towards the brain. Okay, another transcranial magnetic stimulation, it is a non-invasive brain stimulation using the magnetic or a radioactive na machine. Okay, they send signals or brain stimulation. While your light therapy, which is used for seasonal affective disorder, okay, from the word light, this uses the light. Okay, so these therapies are often used when other treatments are not effective. Again, if the other treatments, if they are not responsive to different medications and different therapies that we have mentioned earlier, which includes milieu, family, group, CBT or your cognitive behavioral therapy, your dialectical behavioral therapy, we have your behavior therapy. If they are not responsive to that, then the last resort is your somatic therapies that may be your electrical convulsive, your transcranial magnetic stimulation, and your light therapy. Okay, so they call this again, light therapy is a somatic or biological therapy used in psychiatric nursing. Okay, it involves exposure to artificial bright light to help regulate mood and improve mental health. Okay, now what are the, so again, here the description and how it works and common uses. Your ECT, okay, medical treatment that uses controlled electrical stimulation of the brain to produce a brief therapeutic seizure. So how it works, okay, so as you can see here, electrical currents are passed through the brain while the patient is under anesthesia, causing a short seizure that changes brain chemistry. So key nursing consideration when patient undergoing electroconvulsive therapy: monitor patient before and after procedure, especially monitor their level of consciousness, ensure informed consent, assess vital signs, maintain airway safety, observe for temporary confusion or memory loss. For your transcranial magnetic stimulation, again, it is a therapy that uses magnetic fields to stimulate nerve cells in the brain. A magnetic coil is placed on the scalp, delivers magnetic impulses that activate areas of the brain involved in mood regulation. So here is the common uses: major depressive disorder, especially when antidepressant medication are ineffective. For light therapy or phototherapy, this uses exposure to bright or artificial light to regulate the mood or biological rhythms. So the patient sit near a special light box that mimics natural sunlight, helping regulate circadian rhythms and serotonin levels. So this is the table that provides discussion of the different somatic therapies. Okay, so what are the roles of nurses, okay, in psychiatric or psychotherapy? therapy. Okay? So nurses play a very important role in psychiatric care. Responsibilities may include establishing therapeutic relationships, encouraging patient participation, and support them in participating in different therapies, monitor their responses to treatment or therapies, and providing education and emotional support. Nurses act as a patient advocates and help ensure continuity of care. Again, psychotherapy is used to reduce the symptoms of the patient and improve their coping strategies, no? And also they may include modifying their unhealthy behavior. It doesn't cure the psychiatric illness or mental illness of a patient. The same with your psychopharmacology. Okay? So in conclusion, again, there are multiple therapies that are used in psychiatric nursing or psychiatric care. Treatment is individualized for each patient. So you have to identify. So again, as mentioned earlier, there is no single therapy that can be used for all different types of patients or people who experiencing different psychiatric illnesses. They don't have a single therapy to be used. There are different therapies which is appropriate to their to their illness. Combination of therapies often gives the best results. So you can either combine the CBT with your behavior therapy, or you're either combine the family therapy with a milieu therapy. So this may improve the outcome of your or the goal. Improve to achieving the goal, okay, of the care. And more importantly, the nurses play a key role in helping patients achieve recovery, therapeutic success, and improved quality of life. Okay, so that will be all for this video. Again, if there are any questions, clarifications you would like to share or ask, okay, from me, please do not hesitate to comment your question below this video, okay, so that I can read and respond to it. So thank you again for watching and have a wonderful day.